through it all, and she really gets it. And I think that in her talk today that she'll be able to try to put us in her frame of mind as much as possible and take us through those things that are so important to our patients. The other thing is we asked all of our speakers to say a little bit about themselves as part of their introductions, and I love Jan's because Jan's doesn't have a stitch about breast cancer in it. She wanted to highlight that she's a Cleveland native. She loves being one with nature and traveling to other cultures. And her children and her grandchildren nourish not only her heart, but her soul, as does yoga. So I think this is a perfect complement to the talk we just had. And thank you so much for being here today, Jan.
Thanks for having me. I'm sorry? You don't have any slides. No. Excuse me if I feel a little vulnerable. As I was going through a lot of my medical records, my journals I kept through my cancer journey, I found myself getting triggered by some emotions I wasn't prepared for. So bear with me if I get a little emotional. I have no history of cancer in my family anywhere. I live a healthy lifestyle. I'm very physically active. I've been a vegetarian since I was 18. By what I knew about cancer, I should not have gotten it, and yet I did. I am, and always, I still consider myself very healthy. Someone will ask me, are you healthy? Yes, other than a little bit of cancer I went through. I am married with 3 children. I'm not practicing anymore. I was an early child educator, and I worked at our family business, Cleveland Lighting. I'll give you a little history as far as I never missed a mammogram. I began at age 40. In 2000, with my children, I am very small, and I gained 100 pounds. And I nursed 3 babies for a very long time. So in 2001, I had decided I needed a breast lift, and I had implants put in. And I never missed a mammogram, kept every year, and they were always normal. In July of 2009, I had intense itching on the right breast, and it kept getting smaller and harder. And I went to the breast center, and they ordered a diagnostic mammogram, which showed the overall assessment was negative. I had an ultrasound, which was also negative. And then a couple weeks later, had an MRI and found the implants were intact. The diagnosis was capsular contracture. And surgery would be cosmetic, so I was in no rush to go. I thought, okay, it's not cancer, I can live with it. In October of 2010, I just started not feeling good. I was really tired, and things bothered me, and I decided I'm going to take care of this capsular contracture. So I went to the same cosmetic surgeon that actually put the implants in, and my simple surgery turned out to be a very extensive surgery, and the doctor told my husband that there was lots of necrosis, and he had never seen anything like it. I don't think he was a doctor that dealt with cancer at all. I got called 5 days later to remind me of an appointment the next day and to please bring somebody with me. At that point, I knew I watched enough medical shows. If they tell you to bring somebody with you, it's not good. And we went, and he told me I had extensive infiltrating lobular carcinoma, pleomorphic and classic type, and the tumor was at least 6.5 centimeters. And he told me all this while never looking at me. He looked down. I was left with all these emotions. First of all, I had gone to the breast center, and I was so angry because I thought I did everything I was supposed to do. How could this be missed? And as I started learning about lobular cancer, I found my story is not unique. It can get missed quite a bit. I was able to get in, due to our work relationship, with a wonderful, compassionate surgeon. And I remember meeting with her, and the option was double or single mastectomy. And I remember saying to her, what would you do if I was your sister, your aunt, or your mother? And she put her hand on mine and she goes, why don't you go home and think about it? She did not want to tell me what to do. I opted for a double mastectomy based on symmetry and no reconstruction. During surgery, my simple mastectomy turned into a very big surgery because, lo and behold, the sentinel nodes on the left side also turned up positive. So I ended up having cancer on both sides. She had to go find the cancer in the left side, and it turned out to be a very rough surgery for me. I stayed 2 nights in the hospital. The pathology report came back that the right side had 8 lymph nodes with macrometastasis. The left side was multifocal, infiltrating lobular carcinoma. They were ER 90% positive, progesterone 30%, HER2 negative. And again, no family history at all. I had an unbelievable support team at that point. I have 3 children. My oldest was 29 at the time. He became my information gatherer. He got all the information he could find, and he actually found me people in different states that were going through cancer to talk to. And he accompanied me to all my appointments, and he knew more about my breast than any son should know about at all. My middle son was living in California. He came home for my surgeries. I've had multiple. And he was a constant support every day of phone calls. My daughter was 23 at the time and completely withdrew. She couldn't deal with it. Part of it, I think, was fear that this could happen to her as well. And part of it was uncomfortable. And that's what I found. A lot of, when you deal with the cancer patient, you don't only deal with the patient, you deal with their families, and some of them can be nuts. My husband had a really hard time because his mode is, I'll fix it, and he couldn't fix it. He was feeling helpless, he was feeling scared, and I ended up really relying on a lot of my friends. Don't ever underestimate the support, how important support system is. People brought in meals. They were available 24/7. At work, our business, we had barbecues and silent auctions to raise money for the American Cancer Society. Our business got involved with Susan Komen. We were trying to do everything we could. And in the process, I was trying to learn everything I could, but I was still so angry that this was missed. I got cards from people I barely knew. When I was going back into all my records, and I found all the cards, and something so simple as sending a card can make the patient feel so much better. They just know that they're feeling supported. And then we had a team for Race for the Place in my honor, and just the enormous amount of support I had. The Gathering Place is a great resource. I use them a lot. The support groups, the therapy, the counseling, the library, because if you think you're dying, the internet will confirm it. So the librarian would go through and weed out articles that would be helpful for me. Then I met a phenomenal oncologist who unfortunately is not here today, but she just tried to put me at ease, and I trusted her completely, but found out I had to have dose-dense ACT treatment, which I know is the red devil. And then I would have 6 weeks of radiation, and then tamoxifen for 5 years. I had not gone through menopause when I first started. I had the treatments always on Thursday, so I would be able to go to work on Monday. I was so afraid. I was terrified I was going to die. I did not know a lot about cancer except for what you do to prevent it. And anything I read, I thought, you have cancer, you're going to die. I have learned that is not the case. And that is why I love to give talks and to talk to women that have been newly diagnosed, because I can give hope, because I'm almost 13 years out. And I spent as much time as I could with my family because I was scared I was going to die. During treatment, I'd like to say it was a walk in the park, but it was not. Nausea was very well managed with Emens, great drug, and Ativan. I know it's off-label for nausea, but it really does work. And the Zofran and the Compazine did nothing. I never had neutropenia. I never missed a treatment. The bone pain from Neulasta is real. Hair loss, yes. These curls are the result of chemo. I had perfectly straight hair before chemo, and it never went back to straight. The hardest part wasn't losing my hair. It was the last treatment of Taxol. I lost my eyelashes and my eyebrows. I thought they were home. That was harder than losing my hair. My eyebrows never came back. I learned how to put them on very well. 6 months after chemo, I ended up with a blood clot in my leg. We're not quite sure if it was from the anesthesia I received in my foot to have a tooth extraction because they couldn't use my arms because of the lymph nodes, and chemo also destroyed my teeth. And we're not sure if it was from the tamoxifen or the injection in my foot. But I was on Lovenox for 3 years because I was advised to try the aromatase inhibitors, but I really did well with the tamoxifen. I'm so physically active, and I was terrified to take them. Everything I read said about joint pain and making you feel old, so I opted not to. Thank goodness, so far so good. Let's see, and excuse me. Radiation was physically not so challenging, except for some burnt skin. Emotionally, was worse than chemo. Getting under a machine to have radiation put in me, or on me, after we're told to avoid all the stuff with radiation, I was unprepared for how emotional that was. And you go every single day for 6 weeks. But I did it, along with using a lot of complementary therapies. Highly, highly recommend them for patients. Acupuncture, massage, yoga, meditation, breath work. Those were all in my toolbox, so I was able to easily access them. I kept a gratitude journal. I think it's really important. Even if you're grateful that day for a cup of coffee, it changes your brain chemistry when you do it on a regular basis. I tried to stay positive. I've never been a why me person. I've always been why not me? And I am not religious, but I am extremely spiritual. Anxiety happened really bad in the middle of the night. That was when I would feel this magnetic pull to the internet and convince myself I'm dying. So I had to learn to really, really step away. And my biggest worry, even to this day, is not what they'll find. I can deal with that. It's what they'll miss. That's what scares me the most. And the more and more I learn about lobular cancer, the more I realize that is not uncommon at all. I was so angry at the doctor that I felt missed my diagnosis until I learned about lobular cancer. And I only hope that women can get diagnosed much earlier than I did. Cancer affects the mind, the body, and the spirit. I finished active treatment in May of 2011, and I finished tamoxifen in 2016. Then I started to think about reconstruction because I felt like a prepubescent boy. No hair, no chest, and I was tiny. Because I gained that weight gain, I qualified for the deep reconstruction, but only on one side. So I have a reconstructed breast, which has where my babies grew. So I look at that as a green breast on the right side. I had an implant on the left side. It was a 12-hour surgery. It was a really, really tough surgery. But I would do it again because the results were amazing. Of course, subsequently, I had surgeries on the left side for capsular contracture again and fat grafting. I don't think about cancer that much anymore. When I have a cough or another symptom that lasts longer than 2 weeks, I do. And I have a medical community around me that will check me out, reassure me, and it helps. Unfortunately, recently they found, we're not sure if it's an oil gland or a cyst in my right breast. So I'm going now for mammograms regularly and ultrasounds. Keeping my fingers crossed on that. Life after treatment. No one prepares you for when you see a doctor every 2 weeks to all of a sudden be told, I'll see you in 3 months. That was scary. Today I go every 6 months, and I find that reassuring. I want to keep going because I feel reassured that, okay, we don't see anything and you're doing well. I decided faith and fear cannot live in my house. I have to choose one, and I chose faith. I try to keep fear away. I believe we have the choice to choose. We have no choice to choose we are dealt, but our power lies in how we deal with what we're dealt. Cancer is definitely a game changer. My life has changed dramatically since cancer, but not in a bad way. I've become more patient. I stay in the present. I let go of unimportant things. I still practice daily gratitude, and I like to give of service. All 3 of my kids are married. I have 3 grandchildren. These were all things I did not think I would ever see. I wish I never had cancer, but because of it, I do live better. Cancer is something I went through. It is not who I am. I live a life of abundance. At age 63, I moved into the Kripalu Yoga Institute for a month, lived, breathed, slept yoga, and got certified. And I wanted to begin to work with women that were diagnosed. And then 2 weeks later, the pandemic hit. So I try to give back when I can. I have regularly spoken at the Gathering Place to medical students about things from a patient perspective, such as making eye contact, such as looking at us as that we are people, not just our disease. I'm very involved with the Fourth Angel program here. I love to talk to women that have been diagnosed recently because I can be a face of hope. I'm almost 13 years out, and I did not have a great diagnosis. After treatment ended, I resumed travel, which I have loved to do. My husband and I, we love to get immersed in other cultures and live among the people in other countries. I'm a big cyclist. I don't put off doing anything anymore. And cancer was always the thing that I thought was going to get me. Until last year, I had a bike accident. And I had a brain bleed and a broken pubic rami bone. And I thought, cancer might not be the only thing that's going to take me out. And knowledge is power. Education about what you are going through is so important to give to patients because it can give them a little bit of control, at least to know what is happening. And one thing, there's a quote by Frank Lloyd Wright that I have it all over my house. I have stones with it that says, "The longer I live, the more beautiful life becomes." Thank you.
I'm not sure where we go from there. Maybe we should just all pack up and head home. But don't do that. Just a comment. I would like to introduce a couple of wonderful ladies who work in our